Mass vaccination events are coming to Virginia, where several thousands of people instead of several hundreds can be vaccinated at a time, as it appears we're entering the last phase of the pandemic. Our Cameron Thompson is live with the latest information from the state capitol. Some promising news, Cam.
That's right, and definitely how the governor framed it after noting that this week is marking 1 year since the first cases and deaths of COVID-19, but pointing to these increase in the vaccination numbers as we work towards herd immunity.
As vaccine supply increases, the state plans to launch several mass vaccination sites run by contractors using funding from FEMA. A total of 13 sites have been identified, with 3 launching next week.
Petersburg, Portsmouth, Danville.
Officials say the Petersburg site will be at the Virginia State University clinic set up this past weekend, and says the goal is to vaccinate several thousand people each day it's run.
These are only individuals who register, so the registration component is still important. We do not request folks to just drive up to these sites.
Regarding registration, Governor Northam encouraged everyone on the state's pre-registration list to ensure that their information is up to date.
Make sure we have your age, your address, and the correct contact information.
And regarding complaints that people haven't been able to find themselves in the system, Dr. Danny Avula says to call the call center at 1-877-VACCIN-VA for help, and says this information could be useful beyond the current vaccination effort.
In the event that, a year down the road we need a booster around this, we would have that database to tap into.
Northam also reiterated the need for people to answer calls from unknown numbers in case it's health districts calling you to schedule an appointment. Northam was also asked several questions about easing more COVID restrictions, including for outdoor high school sports. While he didn't commit to anything, Northam did express hope that the current limit of 250 could change next month.
If these numbers continue, if the trends continue to be favorable, we'll make further modifications that will start on April 1st. So I would say more to come in that regard.
Now, officials were also asked about changing visitation guidelines for long-term care facilities. The state's health commissioner said that one of the issues there is because of the turnover rate of residents in those nursing homes leads to issues with maintaining a high vaccination rate, but it's something they'll be discussing with management at those facilities. Working for you at the state capitol, Cameron Thompson, CBS 6 News.